Hello, my name is Janelle Co, and this is my research proposal for my capstone class. So my topic is the negative psychological effects of Black elderly residents living in a nursing home versus those who do not live in a nursing home. So there are approximately 15,700 nursing homes in the United States. Despite having many nursing homes, the most expensive nursing homes provide the best medical help. On average, nursing homes consist of the elderly from ages 65 and higher, which is the average age for retirement as well. Many research studies focus on how much the cost of nursing homes are when average people retire and how the lifespan of the elderly is increasing, but studies lack on ways to help others, specifically the Black individuals. This research proposal will examine the relationship of the negative psychological effects that the Black elderly residents who are living in a nursing home experience versus the Black elderly who do not live in a nursing home. This PowerPoint will include the purpose of the study, research question, literature review, limitations, methodology, ethical considerations, and the appendices. The purpose of the study is to compare the negative psychological effects between the Black elderly who are living in a nursing home and those who are not. When individuals grow old, they all want to have a healthy, encouraging retirement. Unfortunately, it is not the case for some. In previous research, there was a study done by Martin, Walter, Kaufman, and Glymour regarding the demographics, social factors, health, and retirement for the elderly population. The likelihood for someone who is Black to be put into a nursing home is much higher than someone who is white. While there are different ethnic people in different homes, there is still a large amount of Black people who do not live in a nursing home. It is apparent that occupation, neighborhood, socioeconomic status, and genetics play a role when it comes to their overall health. The research question in this research is that there are no interventions for Black individuals struggling with negative psychological effects. Black individuals struggle daily on average from discrimination, but it can be quite noticeable in nursing homes. Will there be an association between the Black elderly living in a nursing home versus the Black elderly who do not live in one? This study aims to provide further acknowledgement of the Black elderly and how someone can experience negative psychological effects. The literature review consists of racial disparities, emotional effects, life satisfaction, and interventions. There are racial disparities and emotional effects that occur within Black individuals living in a nursing home and even those who do not live in a nursing home. The emotional effects that one may experience will vary from each individual. Life satisfaction is essential for an elderly who is retiring or staying in a nursing home. The quality of care they receive plays a big factor in the overall life satisfaction. There are possible ways to implement treatment plans to fulfill their retirement or their nursing home stay. The limitations. In research, there will be limitations that will be present. Since this study revolves two variables and how it can affect the elderly negatively, it can be difficult to determine the causal relationship since it is a correlational study. According to Spector, despite not being able to reflect causality, correlational designs can present evidence to determine that a relationship between variables exists. Also, a correlational study cannot determine the causal relationship between an elderly resident's racial identity and their nursing home stay. Since these studies compare more than one variable, it consists of collecting data to prepare an analysis. However, the research is able to determine whether a relationship will be present. Internal validity is very low in the study since there's nothing being manipulated. The sample size is a limitation as well because it is a small sample size, but having a large sample size would be better at fluctuating the study and canceling out in a systematic sample size. A systematic sample size is easier to control when taking the appropriate steps in the research method. The methodology will consist of participants, materials, procedures, and design. So the participants will consist of a total of 50 Black elderly individuals and will be randomly chosen so that the data does not interfere with any bias. 25 will be from a nursing home and 25 will not be from a nursing home. There are many nursing homes in Arizona, so bringing in participants will not be as complicated. In contrast, the individuals who do not live in a nursing home will be chosen by putting up a sign if someone who is retired and living at home would be interested in partaking in a research study. The materials for the proposal will have a consent form to provide the participants all the necessary details, and they will have the option to opt out of the study. In addition, the individuals who participate will be confidential to protect their identity. The participants will be given paper and a pencil to be able to participate in the series of questionnaires. The procedures will be for the individuals who are participating in the study to fill out a questionnaire. The questionnaire will consist of questions for them to report on how they feel on a scale of 0 to 10. It will have questions that will be about their health, quality of care, feelings, and other factors. There will be 50 participants total, so it is important that they all participate so the study has a chance to be significant. If the participants do not partake in the questionnaire, the study will be difficult to move forward. When all 50 participants partake in the study, there will be high validity since it can be accurately measured. It can also have high reliability because the measure will be consistent. External validity will be very high since the study can be generalized to certain groups or situation. The design of the proposal will be using a correlational design. A correlational design will be used to determine if the relationship between an elderly person of color living in a nursing home is significant to experiencing negative psychological effects instead of an individual not living in a nursing home. This design is best for the proposal because it can discover a relationship between each of the variables. Using a Pearson R will allow the study to determine whether there is a significance. The obstacle that could occur when choosing this methodology is that it will only uncover a relationship, but it will not be able to provide a conclusive reason behind the relationship. The ethical considerations have expanded from the past decades and have continued to grow. Kim states that having an informed consent letter and debriefing form is essential. In order for participants to be protected from harm, it's recommended that a description of study risk, benefits, alternative procedures, confidentiality, voluntary participants, and withdrawal privilege is present. Ethical considerations are important since a lack of ethics would impact the study. A lack of ethics would cause a study to not be successful, become unethical, and lose the credibility. So it is important to do no harm to others. The ethics of care all allow researchers to sharpen their understanding and learn from others, thus having a more fulfilling way to respond to ethical guidelines. In the future study that will be conducted, ensuring that the participants feel comfortable about participating will be very crucial because this can encourage a participant to strengthen autonomy and dignity. This is the appendices. This consists of an informed consent form and debriefing form. And here are my references. Thank you.